Knock, knock, knock. Gonna sanitize my hands, put some gloves on. Hey, Miss Smith, my name's Rhiannon. I'm gonna be your nurse today. The doctor just wants to put a quick catheter in you, just since we're not up and moving around. So can you verify your name and date of birth? Verify name and date of birth with the patient's wristband. I verified in the chart that the patient has no allergies to betadine or shellfish, but I'm gonna again reiterate to the patient that we will be using these, and if she has any allergies to let me know. She does not. So I'm gonna come over here, I'm gonna grab my latex catheter tray. I'm gonna open the box up using sterile technique, only grabbing on the 1-inch borders. All right, open this up. Try and prevent reaching over. We're gonna grab our sterile gloves. We're gonna use our drape for this patient since we have a female patient. We're gonna have the shiny side pointed down, still again touching only on the 1-inch borders. Doing our best. All right, I'm just gonna put this drape underneath you, Miss Smith. Be sure not to touch her legs, knowing that we can adjust it if we need to afterwards. We can throw this away since this is not a male patient. All right, now I'm gonna put my sterile gloves on. Again, only touching on the 1-inch borders. All right, put these gloves on. Still make sure we don't touch the inside, even though these have been used. And we'll adjust them when we're done. Of course, since I have my sterile gloves on, now I can adjust my fingers as I need to. Forever. Just ignore that. Of course, if they ripped in real life, I would just exchange them for a new pair, but we'll just keep going. Goodness gracious. Okay, so I've got my box. I'm gonna situate my box still within the 1-inch borders. Gonna take all my stuff out. We're gonna take the catheter and make sure we coil it nicely. So when it's time to insert it, we have it all set up appropriately. Make sure you keep a nice feel for that. All right, so stay away from the sterile field. Just gonna drop that right there. We're gonna take our syringe, fasten it to our hub. All right, gonna dump this lube in the corner of the box. And we're also gonna drop our betadine swabs right here on our plate as well. Okay, now we've got all of this set up. I'm gonna bring this over to the patient. All right, Miss Smith, I'm getting ready to put that catheter in. We're just gonna clean you up. We have already done our perineal care. So we wanna make sure we hold those open. We're gonna do one swab here. We're gonna drop it. One swab on the outside. We'll drop it. And down the middle. Now that we're done with this, take that away. All right, now we're gonna get our catheter. And we're gonna insert it. Miss Smith, I want you just to bear down for me. So we're gonna slide this in. And of course, in a normal vagina, we would have a little bit more length, but considering what we're working with, we see that flash of urine. I'm gonna insert my syringe, unscrew it, give it a nice little tug. So it's fastened. We're gonna get our stat lock. I'm gonna get all of this pulled out of the bag. I'm gonna change my gloves real quick since I have betadine all over them. Just gonna take these off. Put a new pair of gloves on. Put our stat lock to our patient's leg. We're gonna secure this to a part of the bed that is non-movable. And of course, you know, we're not gonna leave this catheter in for too long. So say 2 days later, when the patient is able to urinate appropriately, we're gonna first empty our bag completely after we've got, you know, nice gloves on. Empty this bag, record whatever output that we do have. We're gonna take off our stat lock with an alcohol pad. We're gonna get our patient to bear down. I want you to take a big deep breath. 1, 2, 3. Pull this out. We're gonna check to make sure the integrity of it's good. Make sure we don't have any mucus or blood or any broken pieces. We're gonna take this. We're gonna make sure we clean her out nice and good. And we are done.